So let's continue to talk about management strategies for a non-relaxing pelvic floor. We already talked about breathing and how important that can be, but there's also some other things that we can do to help to relax that pelvic floor. Obviously, this isn't the best setting for me to show you different stretches that you can do for a non-relaxing pelvic floor. But I would say anything that widens that pelvic outlet can be a really nice stretch to kind of get to know what it feels like to relax that pelvic floor. So they can be things like child's pose, happy baby, downward dog, anything that turns your knee inwards, so internally rotates your thigh bone, that can help to lengthen the back of the pelvic floor. So it might be worth having a look at different stretches for that pelvic area. And we can always provide you with a list of stretches that might be quite helpful. Other things that can be helpful alongside our breathing and our stretches are different tools. So, in pelvic health physiotherapy, for women who have a non relaxing pelvic floor, who may even have vaginismus or pain around the vulva called vulvodynia, we might use different tools to desensitize that area to allow their pelvic floor to relax. The first one of these things is a pelvic floor wand. So, this here is a pelvic floor wand. This pelvic floor wand can be used as an internal device into the vagina to help to relax the pelvic floor tissues. So what happens is that you put lubricant on this pelvic floor wand and this is inserted into the vagina. And what you might do is find different spots in the vagina that are tense or painful. And with that, you might move your leg around and that helps to internally massage, or you might move the wand around. And this shape of the wand really allows for that. Some top tips when you're using a wand: make sure you are comfortable. You want to be supported by pillows. You want to be in a place where you know you're going to be alone. You want to use lubricant onto the wand. Now, this can be really helpful. The one thing I would say about massage and wands is I often think that people conflate what is happening when we are using a wand. Whilst this is massaging internally, we can't spot reduce tension in muscles by using a wand, right? It will feel nice to massage that area. And what that will do, it will calm your brain down. So there will be an overarching effect of that parasympathetic, that calming nervous system, which will help you to relax and desensitize your vagina or your pelvic floor muscles. So this wand can be really helpful to calm your nervous system down and allow you to get used to what it feels like to have something inserted into your vagina. So I think these wands are a great tool. You can use this vaginally or you can use this rectally. My advice would be trying this in of yourself can be useful, but if you are really struggling, I would get an assessment with a pelvic health physio. If you are struggling more with penetrative sex, there are another tool that we might use, and this is a dilator. So dilators come in different sizes, and we might start, if you are struggling inserting a finger or a tampon, you might start with a small dilator. These are inserted into the vagina, and alongside this insertion, what I would say is that you want to think about your deep breathing strategies, because we want to continue to calm that nervous system, because what happens is we get into a vicious cycle, and when we anticipate anything penetrative, we become tense, and that way what happens is we then start to fear anything penetrative and it goes round in a circle. So we need to break that cycle. So doing our deep breathing techniques can calm our nervous system down, and then we might look to insert the smallest dilator. When we become comfortable with that, you can either leave this in there a little while, move it around, it's whatever you're comfortable with, making sure you're comfortable with lubrication. We might then want to move to a larger size dilator, and there's lots of different stages in between, but these can be really, really helpful to start to allow you to have penetrative sex. It is a process, it is a spectrum. There are not particular time frames that you should use one or the other, but you want to build up through the sizes, and you might even want to involve your partner within this. Remember, it comes alongside calming down your nervous system with breathing techniques.